Yes, today's topic is the circulatory system. Why that circulatory system is required, what is circulation, and we will study with some beautiful animated videos so that we know don't need to go in very deep, but as far as the problem concerned we need to address, at least we should know where is the heart, and the size of the heart is of just our fist. It is said that it is of our fist, so it is slightly towards left, and this all we will see in the video. And after that, how we have distributed our study today, we'll see the video, and we will discuss about some of the important parts of the heart, like pericardium, endocardium, and like that, and heart walls. Why? Because these are the things they can't address. The allopath can't address this, but we as a spiritual healer, we can support this system. There are very good remedies for the heart walls also, like spongia. In homeopathy, spongia is used for heart walls. Because what is a spongia? You know, in the sea, it is in the form of plant. This is a sea plant. But when it comes out of the water, it becomes hard like stone. That is a specificity of the spongia. That is called as spongia tosta. That is a wonderful remedy for heart walls. We will study all that. In between, I find something interesting. I'll stop and tell you. Let us go to the videos now. Okay. Uh, in that one, wherever you get again doubts and all, we will again discuss. And after this, we will go to the Vishwambar Das. We will study top three remedies of the different diseases, so that probability of tackling you addressing will be by the same three topmost remedies. And then we will come back to the our selection for good health, our Sairam collection of the diseases, and what we can give from our remedies, like volume 3 or numerical elementary medica. We'll go there and we'll try to analyze and understand how we can take care of a patient. I know, and I can't stop telling you that our OM heart, OM7, is a wonderful, wonderful, wonderful combination, or you can say organ heart, OM7. I have seen result within 15 days. Many people, when they come, when they climb the stairs, they become breathless, and OM7 gives relief in 7 days. Okay, so this is my personal experience with the heart related issues, and anyway, they will be coming to us as an additional support along with their medication. We are not supposed to change their medication. Let them continue, and they are very eager to stop their remedies. But you should not give any direction. Let their own doctor decide what is best for them. Okay. So always we think we are for the additional support. Okay. Then they will be fine. Ultimately, what is our goal? To have a healthy life. Okay. And so live as much as possible without any much trouble. That is only our main ambition, or you can say main aim of our therapy, or you can say. till the time they are alive, they are good. They should be happy, healthy, because even the what so-called God like Rama, Krishna, they are also died. Okay, we can't make them, like a Hanumanta. We can't make them Chiranjeevi. But till the time, the best, what best knowledge we have, or you can say we have to acquire the knowledge, study, and even I shared you today itself in the group, cardiovascular system. Go in the detail. Whenever you get doubt, go to the Google and try to find out. May not be today you will be able to understand, but read it frequently, then you will understand that. And you need to study whatever is required for you for the spiritual healing and vibrant healing. Okay, this if you're going deep, that's very nice. Let us first, because we are talking for the circulatory system, main is our motor. What is our motor? Pump, or you can say pump, we can call. Pump is a heart is a pump is a heart is a pump. So you can say we will study the heart. I want to tell you here, because before going through all this, heart as a, you can imagine heart as a human body. Heart has a circulation, heart has a excretion, heart has a, muscular system and everything, complete system a heart is having. Can you see this? These are called as a heart valves. See, we have seen, na? It's a wonderful animation of heart. So on that, you saw that arteries and veins, they are called as coronary arteries. And there only one get the obstacles, blockage, and that particular part become dead, and it hypokinesthetic, means it will become a less, we can say strength, or you can say movement will be less, because that area of the heart we go dead. That's called as the infraction. Okay, so that we studied in the heart, structure of the heart. Now let us see one even Hindi video is there. He has explained it very well. And with the all, and there also we will stop some other area and to discuss in the details.
Hello everyone.
Yes, this starting animation, if you see it at least 3-4 times, you will totally understand about the circulatory system. So you study, remind and see these part again and again. Otherwise, I will share his video, also his video link. You can see. So I will show you once again. That is very interesting and
वेलकम टू पैरामेडिकल विज्ञान। आज का हमारा टॉपिक है कार्डियोवैस्कुलर सिस्टम या फिर इसको हम सर्कुलेटरी सिस्टम भी बोलते हैं। तो कार्डियोवैस्कुलर सिस्टम या फिर सर्कुलेटरी सिस्टम जो होता है उसमें क्या क्या चीजें
we'll do it once again because you have to see it very carefully.
हेलो एवरीवन, वेलकम टू पैरामेडिकल विज्ञान। आज का हमारा टॉपिक है कार्डियोवैस्कुलर सिस्टम या फिर इसको हम सर्कुलेटरी सिस्टम भी बोलते हैं। तो कार्डियोवैस्कुलर सिस्टम या फिर सर्कुलेटरी सिस्टम जो होता है उसमें क्या क्या चीज़ें आती हैं हमारी। इसमें आता है हमारा हार्ट, हमारे ब्लड वेसल्स और हमारा ब्लड। तो ये सब मिला के क्या बनाते हैं, हमारा कार्डियोवैस्कुलर सिस्टम बनाते हैं। कार्डियोवैस्कुलर सिस्टम या फिर सर्कुलेटरी सिस्टम मतलब सर्किट, एक सर्किट बना रहे हैं ये। इसमें क्या होता है, सबसे मेन ऑर्गन क्या होता है, हमारा हार्ट होता है। तो हार्ट के बारे में जितनी भी डिटेल होती है सब कुछ हम आज के लेक्चर में अच्छे समझेंगे, एनिमेशन की हेल्प से देखेंगे। काफ़ी टाइम लगा मैंने इस वीडियो में, तो आपको जितना भी ईजिली समझा सकता था ना मैं, उतना ईजिली मैं समझाऊंगा इस वीडियो के अंदर। ओके, तो वीडियो को एंड तक जरूर देखना और वीडियो को लाइक ज़रूर कर देना। तो देखिए, सबसे पहले पढ़ते हैं हम हार्ट क्या होता है हमारा। ओके, तो हार्ट को हम मेडिकल टर्म में कार्डिया बोलते हैं या फिर कार्डियक बोलते हैं। पीछे सी लगा देंगे तो कार्डियक। तो मेडिकल टर्म है हमारा कार्डियक। कार्डियोलॉजी क्या होता है, स्टडी ऑफ हार्ट। ठीक है, तो हार्ट की स्टडी करने को हम कार्डियोलॉजी बोलते हैं। और कार्डियोलॉजिस्ट कौन होते हैं, जो कि हमारे हार्ट के स्पेशलिस्ट होते हैं। ओके, तो ये हमारे छोटे से जो मेन चीज़ें होती हैं वो आपको बता दी मैंने हार्ट के बारे में। ओके, और हमारा जो हार्ट होता है ये क्या होता है, इसके बारे में थोड़ा सा और पढ़ लेते हैं। ये एक होलो मस्कुलर ऑर्गन होता है। होलो मतलब खाली, अंदर से कैसा होगा, खाली होगा। उसमें क्या आ सकता है, हमारा ब्लड आ सकता है। ओके, और मस्कुलर ऑर्गन यानी कि मसल से बना हुआ है आपका ये। ओके, ऑर्गन है। ठीक है, तो बहुत सारे हमारे टिश्यूज मिलके, सिमिलर टाइप ऑफ टिश्यूज मिलके ऑर्गन बनाते हैं। तो ऑर्गन है हमारा ये होलो मस्कुलर ऑर्गन होता है हमारा हार्ट। फंक्शन क्या होता है इसका, पंप्स ब्लड। ये क्या करता है, पंपिंग ऑर्गन है हमारा। हमारे ब्लड को क्या करेगा, पंप करता है। जैसे हमारा कूलर होता है ना, कूलर में मोटर होती है, वो क्या करती है, सिर्फ पानी को घुमाती रहती है, दाएं से बाएं सब जगह घुमाती रहती है। ऐसे ही हमारा ब्लड है, हमारा हार्ट है। तो हमारा हार्ट क्या करेगा ना, हमारा ब्लड है उसको क्या करेगा, पूरी बॉडी में सर्कुलेट करता है। ठीक है, एक पूरे सिस्टमेटिक तरीके के साथ। ओके, तो पंप करता है ब्लड को, और जिससे पंप होकर क्या होगा, वो पूरी बॉडी में सर्कुलेट हो जाए। वेट कितना होता है इसका, इसका वेट होता है लगभग मेल्स में 310 ग्राम और फीमेल्स में कितना होता है, 255 ग्राम्स। ओके, और साइज कितना होता है इसका, पर्सन्स फिस्ट अप्रॉक्स। तो यानी कि पर्सन की जो मुट्ठी होती है, फिस्ट होता है। ओके, तो उसके बराबर क्या होगा, उसका साइज होगा। फिस्ट मतलब इतना पोर्शन क्या होगा आपका, फिस्ट होगा। तो इधर तक क्या होगा आपका, पेशेंट का हार्ट का साइज होता है। तो हर एक पेशेंट पे आपका वेरी करता है ये। लाइज ऑब्लिकली बेस अबव एंड एपेक्स बिलो। तो हमारी बॉडी में कैसा होता है ये, ऑब्लिकली थोड़ा सा टेढ़ा होता है, थोड़ा टेढ़ी पोजीशन में होगा। जिसका बेस का होगा आपका, बेस ऊपर होता है। तो उल्टा होता है हमारी बॉडी के अंदर ये। बेस मतलब क्या होता है, नीचे वाला पार्ट। लेकिन इसका नीचे वाला पार्ट कैसा होगा, ऊपर की साइड पे होता है। और इसका एपेक्स मतलब चोटी जो है वो नीचे होती है। तो उल्टा पोजिशन में पाया जाता है हमारी बॉडी के अंदर ये। अब देखिए, हमारा जो हार्ट है ये पंप करता है लगभग 7,200 लीटर ब्लड एक दिन के अंदर, पूरी बॉडी के अंदर। ठीक है, तो 7,200 लीटर आपका ब्लड आपका पंप कर देता है लगभग। और हार्ट बीट आपकी कितनी बार धड़कता है, ये हमारा ब्लड, आपका जो हार्ट होता है कितनी बार धड़केगा, 1,00,000 एक दिन के अंदर लगभग। एवरेज बता रहा हूं मैं आपको ये। और हार्ट बीट आपके एडल्ट्स में कितनी होती है, 60 से 80 बीपीएम। और न्यूबॉर्न्स बेबी में कितनी होती है, 70 से 190 बीपीएम। बीपीएम मतलब बीट्स पर मिनट। तो न्यूबॉर्न्स बेबी की लोग बोलते हैं कि काफ़ी जो नए स्टूडेंट्स होते हैं, वो आपके फ्रेशर्स होते हैं, वो दिक्कत में आ जाते हैं कि उनकी ब्रीथिंग होती है बच्चों की काफ़ी ज़्यादा हो रही है, लेकिन वो नॉर्मल होती हैं। 190 तक नॉर्मली मानी जाती है न्यूबॉर्न्स बेबी में। ओके, तो अडल्ट्स में कितना होता है, 60 से 80 बीपीएम। या फिर हम आपको पढ़ा होगा आपने, तो 72 बीट्स पर मिनट नॉर्मल हम बोलते हैं हमारा हार्ट बीट। ठीक है, तो ये होता है हमारा अडल्ट्स में। ओके, अब हम चलते हैं हमारे हार्ट के बारे में और थोड़ी इसकी एनाटॉमी देख लेते हैं हार्ट की। तो हार्ट इज अ कोनिकल होलो मस्कुलर ऑर्गन सिचुएटेड इन द मीडियास्टिनम एंड इनक्लोज्ड विद इन द पेरिकार्डियम। तो हार्ट क्या है, कोनिकल कोनिकल मतलब थोड़ा कोन शेप में है, नीचे की साइड से आप थोड़ा त्रिकोण बन रहा है, ये कोन बन रहा है थोड़ा सा, कोनिकल है, होलो है, बताया मैंने अंदर से होलो होगा, खाली होगा, मस्कुलर ऑर्गन है, सिचुएटेड इन द मीडियास्टिनम। मीडियास्टिनम मतलब ये हमारा रीजन होता है, इसको क्या बोलते हैं, इस रीजन को हम मीडियास्टिनम रीजन बोलते हैं। तो उसके अंदर प्रेजेंट होता है ये, एंड इज इनक्लोज्ड विद इन द पेरिकार्डियम। तो पेरिकार्डियम मतलब कि एक लेयर होती है जिसके अंदर आपका क्या होता है, हमारा हार्ट प्रेजेंट होता है। ओके, या फिर पेरिकार्डियम स्पेस बोल लो, पेरिकार्डियम लेयर बोल लो, उसके अंदर हमारा हार्ट पाया जाएगा। फाउंड इन मीडियास्टिनम बिटवीन द लंग्स, ऑन द टॉप ऑफ द डायफ्राम, बिहाइंड स्टर्नम, इन फ्रंट ऑफ थोरेसिक वर्टिब्रा एंड प्रोटेक्टेड बाय रिब्स। अब इसका मतलब क्या है, ये जो हार्ट है, एक तो सबसे पहली चीज मीडियास्टिनम रीजन में पाया जाता है, ये जो रीजन है मीडियास्टिनम रीजन है, इसमें पाया जाएगा। बिटवीन द लंग्स यानी कि लंग्स के बीच में, दोनों साइड पे क्या है इसके, लंग्स हैं, तो इधर आपके लंग्स के बीच में पाया जाएगा। ऑन द टॉप ऑफ द डायफ्राम, डायफ्राम क्या है, ये हमारी डायफ्राम वाली मसल है जो कि ब्रीथिंग में काम आती है, तो डायफ्राम मसल के जस्ट ऊपर ये पाया जाता है। बिहाइंड स्टर्नम, स्टर्नम मतलब कि हमारी ब्रेस्ट बोन, ये हमारी स्टर्नम है, तो स्टर्नम के पीछे पाया जाएगा। एंड प्रोटेक्टेड बाय रिब्स, ठीक है, इन फ्रंट ऑफ थोरेसिक वर्टिब्रा। तो थोरेसिक वर्टिब्रा आपके पीछे होती हैं, ये देखो ये हमारी क्या है, पीछे थोरेसिक वर्टिब्रा आ रही हैं, तो थोरेसिक वर्टिब्रा के जस्ट सामने होगा, और साइड्स में क्या होंगी, इसको प्रोटेक्ट करने के लिए रिब्स भी होती हैं, जैसे लंग्स को प्रोटेक्ट करती हैं ऐसे हमारे हार्ट को भी प्रोटेक्ट करती हैं हमारी रिब्स। ओके, 1/3 situated on the right and 2/3 part on the left of the midline। तो हमारी जो मिडलाइन, अगर इसको हम देखें, मिडलाइन अगर हम मान लें हम, तो इसमें आपका 1/3 हिस्सा कहाँ पे होगा, राइट साइड में होगा, और 2/3 हिस्सा हमारे हार्ट का लेफ्ट साइड पे होता है। तभी हम बोलते हैं क्या, हमारा जो हार्ट है वो लेफ्ट साइड में होता है, लेफ्ट साइड में पाया जाता है। लेकिन हमारा हार्ट जो है राइट साइड में भी होता है, लेकिन कितना हिस्सा होता है उसका, 1/3 हिस्सा हमारा राइट साइड में होता है सिर्फ। ओके, इसमें कंडीशन आती है डेक्स्ट्रोकार्डिया। कुछ लोग बोलते हैं कि बहुत रेयर पेशेंट्स ऐसे होते हैं, कुछ बहुत पेशेंट नॉर्मली होता है वैसे ये, कि कुछ का दिल क्या होता है, राइट की जगह आपका लेफ्ट की जगह राइट साइड में पाया जाएगा। ओके, तो उसको उस कंडीशन को क्या बोलते हैं, उसको हम बोलते हैं डेक्स्ट्रोकार्डिया बोलते हैं उसको। ओके, डेक्स्ट्रोकार्डिया। अब आगे चलते हैं हम, ये क्या है, हमारी हार्ट की लेयर्स हैं। ओके, तो हार्ट की लेयर्स देख लेते हैं हम। हमारी जो हार्ट की लेयर्स होती हैं वो कितनी होती हैं, 3 लेयर्स होती हैं। एक होती है हमारी पेरिकार्डियम, दूसरी होती है हमारी मायोकार्डियम, और तीसरी होती है हमारी एंडोकार्डियम। अब कुछ जगह आप
you have seen pericardium, myocardium and endocardium. इसी को आगे आइटिस लगाने से the inflammation of that particular layer हो जाएगा। Okay, layers of the heart. So pericarditis, myocarditis or endocarditis. So whenever you find the prescription of the cardiologist, you will find one of them, and we have a wonderful remedies for this.
आपको पेरिकार्डियम की जगह एपिकार्डियम भी लिखा हुआ मिलेगा। ठीक है, तो एपिकार्डियम बेसिकली क्या है, हमारे पेरिकार्डियम लेयर का ही पार्ट होता है। ठीक है, तो उसकी जगह आप एपिकार्डियम भी बोल सकते हैं, लेकिन पेरिकार्डियम जो है वो मेन लेयर होती है। ठीक है, तो इसको मैं समझाऊंगा आपको, लेयर्स जो हमारे हार्ट की होती हैं उसको नेक्स्ट वीडियो में बताऊंगा आपको डिटेल में। ओके, एक एक चीज पढ़ेंगे इसके बारे में अच्छे से डिटेल में। अब हम देखते हैं चैम्बर्स ऑफ हार्ट। हमारा जो हार्ट है उसमें कौन कौन से चैम्बर्स होते हैं। तो आप ये देखिए, ये हमारा हार्ट है। इस हार्ट में आपको दिख रहा होगा ये जो ऊपर वाले हैं इसको हम क्या बोलते हैं, एट्रिया बोलते हैं या फिर एट्रियम बोलते हैं। ठीक है, आर मतलब राइट और एल मतलब लेफ्ट। आर ए मतलब लेफ्ट एट्रियम और एल ए मतलब लेफ्ट एट्रियम। ओके, ऊपर जो होंगे वो होंगे क्या, एट्रियम, और नीचे वाले क्या होते हैं, हमारे वेंट्रिकल्स होते हैं। राइट और लेफ्ट सेम दोनों के लिए। ठीक है, राइट साइड और लेफ्ट साइड के लिए हमने बोल दिया। तो हमारा हार्ट में कितने चैम्बर्स होते हैं, हमारे 4 चैम्बर्स होते हैं। ओके, अब इसका आपके जो दिख रहा होगा ये, इनके बीच में क्या है, हमारे एट्रियम और वेंट्रिकल के बीच में क्या है, हमारे वॉल्स प्रेजेंट होती हैं। ठीक है, वॉल्स क्या करती हैं, ताकि हमारा जो ब्लड है वो वापस आपके दोबारा पीछे ना चले जाए। तो वॉल्स का हमारा ये काम होता है कि हमारा जो बैक फ्लो होता है ना, ब्लड अगर आपका सपोज करो इसमें आ गया तो इससे आपका वापसी बाहर ना चले जाए, या फिर इसमें आ गया वेंट्रिकल में एक बार तो दोबारा एट्रियम में ना चले जाए। तो बैक फ्लो को प्रिवेंट करता है हमारा वॉल्व। ओके, तो ये 2 वॉल्व्स प्रेजेंट होंगे इन दोनों के बीच में, जिनको हम क्या बोलते हैं, एवी वॉल्व बोलते हैं, या फिर इसका दूसरा नाम क्या होता है आपका, मेन एवी का मतलब क्या होगा आपका, एट्रियो वेंट्रिकुलर वॉल्व। ओके, एट्रियो वेंट्रिकुलर वॉल्व, क्योंकि ये एट्रियम और वेंट्रिकल के बीच में प्रेजेंट होता है। ओके, तभी इसको मिला के क्या नाम बोल दिया हमने, एट्रियो वेंट्रिकुलर वॉल्व। अब ये क्या है, इसके बाद इसके अलावा क्या होगा, वेंट्रिकल से जब ये ब्लड निकलेगा तो आपका इधर आपकी एक आर्टरी जा रही है, पल्मोनरी आर्टरी, इधर से आपकी एक आयोटा जा रही है, तो इन दोनों के बीच में भी आपके वॉल्व्स प्रेजेंट होते हैं। इधर आपके कौन से वॉल्व्स प्रेजेंट होंगे, ये होते हैं हमारे सेमी ल्यूनर वॉल्व, क्या बोलते हैं इसको हम, एसएल वॉल्व या फिर सेमी ल्यूनर वॉल्व। ओके, तो ये आपके दो वॉल्व्स इधर भी प्रेजेंट होते हैं, जो कि वेंट्रिकल से आपका बाकी जब आगे जाएगा, हमारे बाकी ट्रंक्स में जाएगा, पल्मोनरी ट्रंक में जाएगा या फिर आयोटा में जाएगा, तो उसमें आपके भी वॉल्व से होते हुए जाएगा, ताकि आपका ट्रंक से वापस आपके इसमें ना आ जाए, वेंट्रिकल में कहीं, ठीक है, या फिर आयोटा से वापस इसमें ना आ जाए। ओके, तो ऐसे होता है हमारा, ये वॉल्स होती हैं। अब ये जो वॉल्स हैं इनके कुछ और नाम भी होते हैं, अलग से कुछ और नाम भी होते हैं, वो देख लेते हैं। तो ये वाला जो वॉल्व होता है हमारा राइट एट्रियम और राइट वेंट्रिकल के बीच में, एवी वॉल्व जो है, इसका क्या नाम होता है दूसरा, इसको बोलते हैं हम ट्राइकस्पिड वॉल्व। ट्राइकस्पिड, ट्राइकस्प का मतलब क्या होता है, इसके बाद वाली स्लाइड में आपको बताऊंगा मैं। ओके, तो ट्राइकस्पिड वॉल्व आपका होगा ये। और ये वाला जो होता है लेफ्ट एट्रियम और राइट आपका लेफ्ट वेंट्रिकल के बीच में, इसको क्या बोलते हैं हम, बाइकस्पिड वॉल्व या फिर मिट्रल वॉल्व भी बोलते हैं इसको। ओके, तो ये इनके दूसरे नाम होते हैं।
This mitral valve stenosis is a common complaint. Stenosis means that becoming a hard. Okay, so in heart prescription, or you can say cardiologist prescription, you will see this very frequently. Okay, so you see that these are all we are available, especially if you come to know that this particular thing is damaged, we can go into the numerical medica and give the spiritual support to this particular area.
आप याद रखिएगा, पक्का क्वेश्चन आपका आ जाता है ये। ओके, एमसीक्यूज में पूछ लिया जाता है। ओके, इसके अलावा आपका ये जो आपका राइट वेंट्रिकल से आपका जो सेमिल्यूनर वॉल्व आपका निकल रहा है, आपका जो जुड़ा हुआ है, इधर आपका ये वाला जो वॉल्व होगा, इसको क्या बोलेंगे हम, इसको हम बोलते हैं पल्मोनरी वॉल्व। ओके, पल्मोनरी, पल्मोनरी मतलब आपका लंग्स, ये आपकी वेन जो आपकी आर्टरी जो जा रही है, पल्मोनरी आर्टरी, ये आपकी कहाँ पर जाएगी, आपके ब्लड को लेके लंग्स तक लेके जाती है। ओके, तो पल्मोनरी वॉल्व होगा। और ये दूसरा वाला क्या होगा, इसको क्या बोलेंगे हम, इसको हम बोलेंगे आयोटिक वॉल्व, जो कि हमारे आयोटा में ओपन होगा, ठीक है, लेफ्ट वेंट्रिकल से। ओके, तो ये हमारे कुछ वॉल्व्स होते हैं और हमारे चैम्बर्स होते हैं हमारे हार्ट के अंदर। अब ये देखिए, मैंने आपको बताया था ट्राइकस्पिड और बाइकस्पिड के बारे में। तो आपका जो ट्राइकस्पिड है, ये आपका ट्राइकस्पिड वॉल्व हो गया, ये हमारा बाइकस्पिड वॉल्व हो गया। अब आपका नाम जो है वो कैसे लिखा गया है, ट्राइकस्प मतलब आपका इसमें देखो, एक ये कस्प है, एक हमारा ये कस्प है और एक हमारा ये कस्प है, तो तीन कस्प इसमें है, तो इसको क्या बोलेंगे हम, ट्राइकस्पिड वॉल्व। ऐसे ही सेम इसमें बाइकस्पिड वाले में क्या होगा, दो कस्प होंगे, एक ये कस्प है हमारा और एक हमारा ये कस्प है, तो इसकी वजह से क्या बोला हमने इसको, बाइकस्पिड। बाय मतलब दो, ट्राई मतलब तीन, ठीक है। तो सिर्फ हमारा ये जो हमारा होता है ना, सिर्फ इसी जगह पे आपका क्या होगा, सिर्फ आपका बाइकस्पिड वॉल्व पाया जाता है, लेफ्ट एट्रियम और लेफ्ट आपका वेंट्रिकल के बीच में, ठीक है। सिर्फ इधर ही आपका बाइकस्पिड होगा, बाकी तीनों जगह आपको तीन ही कस्प मिलते हैं। एक इधर तीन कस्प है, इधर भी आपका तीन कस्प होते हैं, इधर भी आपके तीन कस्प होते हैं, ठीक है, एओर्टिक वॉल्व में और पल्मोनरी वॉल्व में। ओके, तो आपको वॉल्व्स आई होप कि अच्छे समझ में आ गया होगा। अब हम चलते हैं नेक्स्ट पार्ट पे, जो कि हमारा ब्लड वेसल्स ऑफ हार्ट। हमारे हार्ट में कौन कौन सी ब्लड वेसल्स होती हैं, इसको देख लेते हैं अच्छे से। तो अगेन इस डायग्राम पे आते हैं हम। ये देखिए, सबसे पहले आप ये देखिए, ये क्या है हमारा सुपीरियर वेना केवा, SVC शॉर्ट फॉर्म इसको बोलेंगे। सुपीरियर वेना केवा क्या करेगा, हमारे हार्ट से जो ऊपर वाला जो पोर्शन होगा हमारी बॉडी का, उधर से क्या करेगा, ब्लड लेके आएगा हार्ट तक। ऐसे ही सेम हमारा इंफीरियर वेना केवा होगा, जो कि हमारा हार्ट से नीचे वाला बॉडी का जितना ही पार्ट होगा ना, उधर से क्या होगा, ब्लड लेके आएगा, ठीक है। जो ब्लड लेके आने का काम करते हैं, जो ब्लू वाले हैं ना, सारा का सारा क्या होगा, उसमें डीऑक्सीजनेटेड ब्लड होगा, ठीक है, डीऑक्सीजनेटेड। तो कैसा ब्लड लेके आ रही हैं, ये डीऑक्सीजनेटेड ब्लड लेके आएंगे। और कहां पे लेके आएंगे, हमारे राइट एट्रियम के अंदर, ओके, इधर लेके आएंगे। देन इसके बाद आप ये देखिए, ये क्या है हमारा, आपकी पल्मोनरी आर्टरी। ये क्या है, हमारी पल्मोनरी आर्टरी। हमारी ये वाला साइड जो कौन सा था, लेफ्ट साइड था, तो इसको क्या बोलेंगे हम, लेफ्ट पल्मोनरी आर्टरी, ओके। और ऐसे ही पल्मोनरी आर्टरी आपकी एक इधर भी निकल रही है, इधर भी निकल रही है हमारे, जो कि हमारे किसके साथ अटैच होगी, हमारे राइट लंग के साथ, तो इसको क्या बोलेंगे हम, राइट पल्मोनरी आर्टरी, ओके। तो दो आपकी पल्मोनरी आर्टरी, लेफ्ट और राइट, ओके, पल्मोनरी आर्टरी दो हो गई। इसके बाद आप ये देखिए, ये क्या है हमारा, पल्मोनरी वेन। राइट साइड पे है तो राइट लंग से लेके आएगी पल्मोनरी वेन, और ये क्या होगी हमारी पल्मोनरी वेन, सेम है, लेकिन ये आपके जो लेफ्ट वाला लंग होगा उधर से लेके आएगी, तो लेफ्ट पल्मोनरी वेन ये वाली होगी। ओके, अब इसमें क्या मैं आपको ना एक एक्सेप्शन बताया था, जैसे कि आपको पता होगा कि ना हमारे जो आर्टरीज होती हैं वो ऑक्सीजनेटेड ब्लड कैरी करती हैं और जो हमारी वेन होती है वो डीऑक्सीजनेटेड ब्लड कैरी करती है। लेकिन ये एक्सेप्शन है कि पल्मोनरी आर्टरी और पल्मोनरी वेन का ये वाइस वर्सा होती है, उल्टी होते हैं थोड़ी सी, ठीक है। तो क्या होता है ना इसमें, रेसिप्रोकल होता है इसमें, कि पल्मोनरी आर्टरी सिर्फ एक ऐसी आर्टरी है पूरी बॉडी के अंदर जो कि कैसा ब्लड कैरी करती है, डीऑक्सीजनेटेड ब्लड, ठीक है। और हमारा पल्मोनरी वेन हमारी एक ऐसी वेन है जो कि कैसा ब्लड कैरी करती है, ऑक्सीजनेटेड ब्लड। ओके, तो ये इसमें उल्टा हो जाता है सिर्फ, ये पूरी बॉडी में एक्सेप्शन है। इसको भी आपका एमसीक्यू में पूछ लिया जाता है, बहुत कॉमन क्वेश्चन है ये, इसको भी याद रखिएगा आप। अब ये देखिए इधर आता है हमारा, ये सबसे ऊपर जो बच गया इसको क्या बोलेंगे हम, इसको बोलते हैं हम एओर्टा। तो ये सारी ब्लड वेसल्स होती हैं जो कि हमारे हार्ट तक ब्लड लेके आती हैं और हार्ट से ब्लड लेके जाती हैं। ओके, अब इसके बाद हम देखते हैं ब्लड सप्लाई टू हार्ट, हमारे हार्ट में कौन कौन सी ब्लड सप्लाई होती है, क्योंकि हमारा हार्ट जो है सब जगह ब्लड पंप कर रहा है, हार्ट में ब्लड आ रहा है, ब्लड पंप कर रहा है, इधर से उधर जा रहा है, लेकिन हमारा जो हार्ट है उसमें उसको भी तो ब्लड चाहिए, तो उसको ब्लड चाहिए, वो ब्लड कौन देगा, हमारा जो आयोटा होता है ना, ये आयोटा क्या करता है, आयोटा हमारा आगे जाके डिवाइड हो जाता है दो आर्टरीज में। इन आर्टरीज का क्या नाम होता है हमारा, राइट कोरोनरी आर्टरी और हमारा लेफ्ट कोरोनरी आर्टरी, ठीक है। तो ये हमारी दो आर्टरीज होती हैं जिनको हम कोरोनरी आर्टरी बोलते हैं, जो कि क्या करती हैं, हमारा ब्लड सप्लाई करती हैं हार्ट को। अब इसके बाद हम देखते हैं ब्लड फ्लो, हमारा जो हार्ट है उसके अंदर ब्लड फ्लो कैसे होता है। ओके, तो आप ये देखिए, ये हमारा हार्ट है, साइड में आपको लंग भी दिख रहे होंगे, ठीक है। तो इसके अंदर देखते हैं ब्लड फ्लो कैसे होगा। तो ये देखिए, ये हमारा क्या है, येलो कलर से आपको बॉल्स दिख रही है, ये हमारा ब्लड मान लो आप। तो इधर से आपके सुपीरियर वेना केवा, इंफीरियर वेना केवा से क्या होगा, आपका ब्लड आएगा किसमें, एट्रियम के अंदर। ये हमारा इंफीरियर वेना केवा से आया, ये हमारा सुपीरियर वेना केवा से आया। ब्लड किस में आएगा, हमारे वेंट्रिकल, आपके एट्रियम के अंदर। कौन से एट्रियम के अंदर, राइट एट्रियम के अंदर, राइट साइड में। ओके, एट्रियम में आएगा और इधर से हमारा कहाँ जाएगा, हमारा जाएगा ये राइट वेंट्रिकल में, वेंट्रिकल से जाएगा हमारे पल्मोनरी आर्टरी में। अब पल्मोनरी आर्टरी से क्या होगा, आपका साइड में लंग्स हैं, तो मैंने आपको बताया था इससे पहले कि आपकी पल्मोनरी आर्टरी दो होंगी, राइट साइड में जाएंगी और लेफ्ट साइड में जाएंगी। ओके, तो हमारा ये जो ब्लड है फिर आगे जाएगा हमारे आपके लेफ्ट साइड वाले लंग्स में और हमारे राइट साइड वाले लंग्स में। किसके थ्रू जाएगा, हमारे पल्मोनरी आर्टरीज के थ्रू। इधर लंग्स में जाने के बाद क्या होगा, जब हम सांस लेते हैं तो ऑक्सीजन आता है। अब हमारे लंग्स में क्या होगा, एल्वियोलाई से क्या होगा, हमारा गैसेस एक्सचेंज होगा, जिससे हमारा जो डीऑक्सीडेटेड ब्लड है वो कन्वर्ट किस में हो जाएगा, हमारे ऑक्सीजनेटेड ब्लड में। ओके, तो इनके क्या कर दिया मैंने, इसमें कलर चेंज कर दिया ताकि आपको अच्छे समझ में आ जाए। ओके, तो इसका कलर चेंज आपका येलो से अब ग्रीन हो गया, तो आप समझ लेना, यानी कि क्या हुआ है, इसमें गैसेस एक्सचेंज हो चुका है, यानी कि कैसे अब हो गया है ब्लड, हमारा ऑक्सीजनेटेड ब्लड इसमें हो गया है, ठीक है। अब ये आएगा किसके थ्रू आएगा, हमारे हार्ट के अंदर पल्मोनरी वेन के थ्रू आएगा, ठीक है। ये हमारा पल्मोनरी वेन है, इसके थ्रू आएगा, और ये भी हमारा पल्मोनरी वेन है, राइट और लेफ्ट, इनके थ्रू कहाँ पे आएगा हमारा, ये कहाँ पे आया है हमारा भी, लेफ्ट एट्रियम के अंदर। ओके, लेफ्ट साइड के एट्रियम में आ गया हमारा ब्लड, आ गया। कैसा ब्लड आया, ये ऑक्सीजनेटेड ब्लड आया है, ठीक है। तो हमारा जो लेफ्ट साइड होती है कैसा ब्लड होगा, उसमें ऑक्सीजनेटेड ब्लड होता है, और राइट साइड में कैसा होगा, हमारा डीऑक्सीजनेटेड ब्लड होता है, ठीक है। तो राइट साइड में आपको दिख भी रहा होगा, ब्लू कलर से है, ब्लू कलर से यानी कि डीऑक्सीजनेटेड, और ये वाला आपको दिख रहा होगा रेड कलर से, यानी कि ऑक्सीजनेटेड ब्लड इसमें होता है, ठीक है। अभी हमारा एट्रियम से निकल के कहाँ पे जाएगा, हमारे वेंट्रिकल में जाएगा। ये देखिए हमारे वेंट्रिकल में जाएगा, और वेंट्रिकल से हमारा आयोटा के थ्रू कहाँ पहुँच जाएगा, हमारी पूरी बॉडी में ये डिस्ट्रीब्यूट हो जाएगा, ठीक है। सिस्टेमिक सर्कुलेशन में आ जाएगा, पूरी बॉडी में डिस्ट्रीब्यूट हो जाएगा। ओके, तो इस तरीके से हमारे हार्ट में ब्लड फ्लो होता है। अब इस दौरान क्या हुआ, हमारे दो सर्किट बने, ठीक है। उन सर्किट को क्या बोलते हैं हम, पल्मोनरी सर्किट और सिस्टेमिक सर्किट, या फिर पल्मोनरी सर्कुलेशन और सिस्टेमिक सर्कुलेशन। इनको देख लेते हैं क्या होता है ये। अब ये देखिए, ये हमारा सेम ब्लड मान लो आप, सेम ड्रॉप से, तो आपका ये जो ब्लड है आपका इंफीरियर वेना केवा से आपका आर्टरी में एट्रियम में चले जाएगा, और सेम हमारा सुपीरियर वेना केवा से भी हमारे एट्रियम में आ जाएगा। ब्लड कलेक्ट हो गया हमारे राइट एट्रियम में, एट्रियम से हमारा जाएगा राइट वेंट्रिकल में, वेंट्रिकल से हमारा पल्मोनरी आर्टरी के थ्रू कहाँ जाएगा, हमारे लंग्स के अंदर। लंग्स में जाने के बाद क्या होगा, इसका गैसेस एक्सचेंज होगा, ऑक्सीजनेटेड हो जाएगा हमारा ब्लड, ठीक है। तो राइट साइड वाला आप देख सकते हैं ऑक्सीजनेटेड, आपका लेफ्ट साइड वाला आपको दिख रहा है ऑक्सीजनेटेड हो गया। ये ऑक्सीजनेटेड ब्लड जो होगा वो आपका किसमें, आपका फिर कैसे आएगा, हमारे हार्ट में दोबारा आ जाएगा, ठीक है। हार्ट में कौन सी साइड पे आएगा, हमारे लेफ्ट एट्रियम में आएगा। किसके थ्रू आएगा, हमारे पल्मोनरी किसके थ्रू? पल्मोनरी वेन के थ्रू आएगा, एक्सेप्शन सेम, ठीक है। पल्मोनरी वेन के थ्रू किस में आ जाएगा? लेफ्ट एट्रियम में आ जाएगा। देन इसके बाद हमारा वॉल्व ओपन होगा, हमारा बाइकस्पिड वॉल्व इधर ओपन होगा, और इसमें क्या होगा हमारा? ये इतना जो ऊपर वाला पोर्शन था ये क्या है? हमारा पल्मोनरी सर्किट है या फिर पल्मोनरी सर्कुलेशन है, जो भी हमारा ऊपर का पोर्शन में कवर हुआ, ठीक है। हमारा हार्ट इधर से लेके इधर तक में क्या हो गया? हमारा पल्मोनरी सर्किट बोलेंगे इसको हम। अब इधर से हमारा जो हमारा हार्ट होता है लेफ्ट एट्रियम में, इधर से कहाँ जाएगा? हमारे लेफ्ट वेंट्रिकल में जाएगा, और लेफ्ट वेंट्रिकल से हमारा क्या होगा ना? लेफ्ट वेंट्रिकल में गया, लेफ्ट वेंट्रिकल से हमारे आयोटा में जाएगा, और आयोटा से हमारे पूरी बॉडी में ये डिस्ट्रीब्यूट हो जाएगा। ओके, तो ये वाला जो पोर्शन है ये क्या होता है? हमारा सिस्टेमिक सर्कुलेशन होता है। ओके, इतना पोर्शन क्या होगा? हमारा सिस्टेमिक सर्कुलेशन। उससे ऊपर वाला पोर्शन क्या होगा? हमारा पल्मोनरी सर्कुलेशन या फिर पल्मोनरी सर्किट। सो दैट्स इट फॉर टुडेज वीडियो गाइज। अगर आपको वीडियो अच्छी लगी हो तो वीडियो को लाइक करना, और चैनल पे अगर पहली बार आया तो चैनल को सब्सक्राइब जरूर कर देना। मिलते हैं हम बहुत जल्दी नेक्स्ट वीडियो में, तब तक के लिए बाय बाय।
So I think so it was very, very clear what is the function of the circulatory system, how left ventricle pumps the blood to the lungs, then it comes to the right ventricle, from right ventricle again, second time it pumps the blood to the whole body. And the summary is left side is deoxygenated blood, or right side, left side is the oxygenated blood, and again pumps for the second time, and it goes all toward all our body. And again, what is required to the cell to be alive? It needs oxygen and nutrition. Bloods, it both the things are provided by blood circulation. So from there again it takes the deoxygenated blood, it supplies the cell all oxygen, and it takes the carbon dioxide and mixes and come back to again left ventricle. So this is the circulation. We will see some more videos to get this idea perfect in your mind, so that telling the same thing in a different language, it is just like that.
Hey everyone, myself Syed Usman Sagar, pursuing third year Doctor of Pharmacy from the SETS College of Pharmacy, Dharwad, Karnataka. Today I am going to discuss a very important chapter, that is human cardiovascular systems in detail. Coming to the introduction, the cardiovascular system is also known as the circulatory system, which comprises the heart, blood vessels and blood. It is responsible for transporting nutrients, oxygens, carbon dioxide, hormones and blood cells to and from the cells in the body, thus providing the nourishment and helping to fight the disease, stabilize body temperature and pH, and maintain also homeostasis. Homeostasis is basically the balancing the internal environment and the external environment. The heart pumps blood through the blood vessels, which includes arteries, veins and capillaries, ensuring that the oxygenated blood reaches through various tissues and organs, and that deoxygenated blood is returned to the lungs for oxygenation. Functions of the cardiovascular systems: it mainly helps in the transport nutrients, hormones, and it mainly helps in the removing the waste products, and also helps in the gaseous exchange, and also helps in the immunity, and also helps in the blood vessels transport blood by carries oxygenated and carbon dioxide, and also carries nutrients and wastes, and also it helps in the heart pumps blood through blood vessels. When coming to the components of the cardiovascular system, it mainly contains blood, heart, blood vessels. Coming to blood is a connective tissue which is fluid in nature and circulates in a closed system of vessels, and total volume approximately 6 liters, and which is pH is 7.4, that is slightly alkaline, and specific gravity about 1.005. Blood contains blood cells and the plasma. Mainly blood cells are the erythrocytes, leukocytes and thrombocytes. Erythrocytes are also called as the red blood cells, and leukocytes are also called as WBCs, and thrombocytes are also called the platelets. And also it contains the plasma, that is fluid portion. Coming to the heart is a four-chambered hollow muscular organ approximately the size of your fist. Location: superior surface of diaphragm, left of the midline, anterior to the vertebral column, posterior to the sternum. See here. Heart mainly contains the aorta, pulmonary artery, left atrium, pulmonary veins, semilunar valve, AV valve, that is atrioventricular valve, left ventricle, right ventricles, posterior vena cava, anterior ventricular valve, semilunar valve, pulmonary veins, right atrium, anterior vena cava, pulmonary artery. When coming to the functions of the heart, it mainly helps in the generating blood pressure and also helps in the routing blood. That is, heart separates pulmonary and systemic circulations, and also heart helps in the ensuring one-way blood flow. That is, heart valves ensure one-way flow, and also helps in the regulating blood supply by changes in contraction rate and force match blood delivery to changing metabolic needs.
हाँ अगर ज्यादा लग रहे हैं तो छोड़ दो.
Coming to the blood vessels, a closed network of tubes. That is, closed network of the tubes is called as a blood vessels, and also it includes arteries, capillaries, and veins. Blood vessels, arteries are thick-walled tubes, elastic fibers, circular, smooth muscles. In capillary, also called as microscopic vessels, which contains one cell thick and serves the respiratory system. In veins, also called as draining channel. Blood vessels generally the structures called tunica intima and tunica media and tunica adventitia. Classification of blood vessels: conducting vessels, distributing vessels, resistance vessels, exchange vessels, capacitance or reservoir vessels. And coming to the arteries are blood vessels that carries blood away from the heart are called as arteries. They are the thickest blood vessels and they carry blood high in oxygen, known as oxygenated blood, that is oxygen rich blood. See here in picture given arteries. Arteries accompanied by veins and nerves, which contain lumen in small and no valves and repeated branching. Classification of arteries: elastic, that is example aorta and its major branches; in muscular, example renal, testicular, radial, tibial, etc. Arterioles, that is less than 0.1 mm. Terminal arterioles, meta-arterioles, and thoroughfare and channels or preferred. In capillary, that is size in 5 to 8 microns, the smallest blood vessels are capillaries and they connect the arteries and veins. This is where the exchange of nutrients and gases occurs. Body contains two kinds of capillaries, that is continuous, that is present in skin, lungs, smooth muscles and connective tissue, and in another one is fenestrated, that is present in the pancreas, endocrine glands, small intestine, choroid plexus, ciliary process, etc. Sinusoids are the large irregular vascular space that is in the size 30 to.
Okay, please when you talk in between, it is very difficult to unmute when video is running. That time, you lose all the connection. So kindly mute yourself when something is going on because they won't listen. it will create disturbance to whole team. Okay. Now, I think you have understood the basic parts of what is the functioning of the heart, how that deoxygenated blood comes into the left ventricle. From there again second time it is pumps to the lungs, and from lungs again it is taken back to the right ventricle. From right ventricle again it is pumping, and it is pumping through whole body. Likewise this circle that continues. Okay, continues. And major issue of the heart is heart has its own circulation. Like a heart has got is a pulmonary, uh, you know, uh, that is called coronary arteries and veins. So is there in that particular arteries, if there is a any blockage, that it makes that area dead, that muscles become infracted, and now that area becomes dead, and it can't pump the blood properly. So this is what is happening there. Now we'll see one more video, short video. And another thing.
Sir,
Sir.
sir, I have a question, sir.
Yes, sir, please.
What about this? What about this? People getting diagnosed with hole in the heart. Usually,
Hole in the
small
heart.
babies they
Yeah,
always
correct,
get.
correct.
Yes.
See, a hole in the heart, we'll see. Actually, hole in the heart means where will be the hole?
Even I don't know, sir. Even I don't know. Usually,
I'll show
doctors they
you.
say
I'll
there's
show
a
you.
hole in the heart in the very young kids, no? So,
Yeah, yeah.
so I don't know where I don't know where the hole comes. So,
Yes, I'll just check.
usually, a newborn baby will have these kind of issues.
Yes. Hole in the heart will be right ventricle, left ventricle is there, no? In between there will be this wall will be very thin. This wall will be very thin. So the uh, uh, can you see? I think you can't see, no? Can
No,
you
No,
sir.
sir,
see
we can
what
see.
I'm telling you? Or only you can see me?
We can only see you. We cannot see your screen.
Okay. I'll share this and then you will be able to see.
Yes, sir. Now we can see,
Yes, you
sir.
can see. The heart in the hole means this particular wall will be thin and the mixing of these two bloods. Heart hole means there will not be any hole from the outside.
Okay,
This
okay.
particular the wall which separate from the oxygenated blood and deoxygenated blood, here there will be a hole.
Okay.
That is called as the heart in the hole. And my elder sister died because of this problem only when she's 2 years old.
Oh,
2 years old, she had this a hole like this. So with that, doctor advised if she can be alive for 8 years, then they can operate. Because I'm talking 1962, 63 like that. So that time the medical facility were not so strong. And one more, my niece is she's a anesthetist nowadays, but she had also same problem. She was operated in Satya Sai Hospital in Bangalore free of cost. The same when she was 3 months old that time. That is the thing. And see, these are all the congenital disease, manufacturing defect. We can't help much, but there is a remedy. One remedy is there for this. Is but anyway, because that is a manufacturing defect, we can't. But there will be a common symptom because they will take the deep breathing. sometime if any person frequently takes a deep breathing, that means you can think that the oxygen level in the body is going low.
What are the symptoms, sir, if anyone having this
Blue,
hole?
actually, if
What?
it becomes a blue baby, it becomes a
Oh,
bluish color in all skin and lips, and thing will be very blue in color
okay,
because of the mixing of
okay, okay.
the
Oxygenated,
oxygenated
deoxygenated.
and deoxygenated blood.
Okay, okay. So, okay.
Yeah, anything, please.
So, I mean, right now, what is the problem? Medically, what do doctors do? Some do they do a surgery, or what do they do
They do the
medically?
surgery. They do the surgery and they stitch this wall.
Okay.
They stitch this wall, and they know precisely, they will identify where is that hole, and
Mhm.
exactly there, that area in between. No, this again it will
Uh-huh.
be covered by the uh, uh, whole system like that. Mean it is a balloon like. So inside
Mhm.
they find out where is the problem. Then they stitch that area.
Okay.
ओके, तो ये इनके दूसरे नाम
So,
होते हैं, आप याद रखिएगा, पक्का क्वेश्चन।
Okay.
okay, sir. Okay. Thank you,
Okay.
sir. Thank you.
Okay. Now we'll go into the major defects of the heart and what are the let us start from our Bishwambar Das, because I keep on telling you, because I can't stop praising that book so much, because those all remedies are, they are written on the priority of the most likely, or you can say probability basis. They are not on the alphabetical basis, probability basis. So okay, again the same problem, I think so. Next time, because after when the blood we are giving, now it is going to the whole body and taking the taking all the giving all nutrition and taking the waste product, and then how it will be cleaned? How it will be cleaned? The scale will be cleaned through the kidneys and excretory system. How our waste product, how it goes to our the how it goes and mixes with the urine, and then how it is excreted out, we will see in the next topic. Now, disease of the heart and the blood, this is from the Vishwambar Das, page number 2 to 5, according to the our reading. Okay, so aneurysm. Aneurysm is a dilation of arteries. When it will happen? When it means the arteries lose their elasticity. Arteries are supposed to, along with when you see the pulse, what happens? At every pulse, it pulsates, or you can say elasticity. It shows its elasticity. It expands and contracts. So if it is losing, it is a coming back property, like contraction property, and it keep on dilating. And that time what happens? The pressure becomes low, and it can't supply to the bloods to the all the parts of the body. That is called aneurysm. And you can see the same thing in our the same thing in our Darbari also. In Darbari also, you will see what is the meaning of it. Then what is the remedy? People will come to you that they are, because there is no any medicine for this. So they will come to you, and the Briata carb is one of the remedy. violent, long-lasting palpitation of the heart by living lying on the left side, fullness of the chest with a short breathing, especially on the ascending, stitching pain in the chest. Like I know, stitching pain in the chest on respiration, on ascending, especially. If when ascending something, some weakness in the heart, if it is as if circulation has ceased because of the dilation of the artery. So bradycardia. See how we have to diagnose. No one will come and tell you I have got a aneurysm, or they may tell, they may not tell. How we will come to know? If they are having the problem throbbing in the back, great weakness, as if circulation has been seized. Because we are very safe, but our remedies work in very gentle way. So you can definitely give them the bradycarb. Next one is carboanimalis. What is carboanimalis? I don't remember which animals they are taking. Means the carbon of the bone, the remedy made by the carbon of the bone. So we will be able to see that in the when we go in the boric materia medica, it will tell you this carboanimalis is made from what animal. Means bone, after burning some blackish portion, that whatever is left, with that they make a remedy and they brew it. Brewing means they give on the healthy subject and note all the complaint, note down the complaint, and if same complaints we are getting on the healthy on the sick person, give that remedy in the diluted form. If there is no potency is written here, that means you have to give in 30 potency, or they will mention the potency like here. Sharp burning stitching pain in the chest, worst on walking, 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 give 1 m dilution. If anybody is getting the sharp burning stitches pain in the chest, worst on walking, give carboanimalis 1 m potency, 1 m dilution. Okay, you can give it 3 times a day. But if it is a original, if you happen to buy in any case from the market, that is not applicable here. You are not supposed to do. You are supposed to do with your thought infuser only. Next, lycopodium. Lycopodium is an aneurysm causing loss of flesh, soreness of lips, tendency to flatulence and constipation. In such cases, you will be declared very easily. Nowadays we have got all modern facility to check all problem. Then it will tell you he is suffering from this so and so problem. Okay. Now, angina pectoris. Angina, as we told you, we are going to study only first 3 or 4 remedies only, because those are the important remedies. And you buy any homeopathic medicine for the heart problem, they are going to have these 4 remedies for sure. Then what you do, I told you very easily how you can, without having the knowledge, how we can create the thought infused pills and water without having the knowledge. Because we are all learning this in Vibrionics as a spiritual healing. So you go to, I used to do like that only. When I was a kid in homeopathy, I used to go to the homeopathic pharmacy and buy, and just, they keep those books, therapeutic books on the table. Free of cost, we can take them. Still you ask them, can I take? And you can take. In that one, for heart problem, this problem, that problem, they will be writing 3 or 4 remedies. All 3 or 4 remedies you can make it from the numerical materia medica. You can make from the numerical materia medica and give for those particular problem. Okay. So nice it is. So in angina means chest pain. Chest pain, angina pectoris, this is a heart pain only. So for that, amyl nitrate and cactus, gluonine and cratagus. Cratagus is a wonderful remedy. Cratagus is a heart strengthener. And I told you in my biochemic lesson, CPKPNM is one of the most wonderful remedy for heart attack preventive. Just somebody suffering from that, don't give him water and all, because just put him into the mouth, CPKPNM, and approach to the nearest hospital, because the first 4 hours or first 2 3 hours is very golden period. It's called as a golden period. During that time, your heart blockage can be very soon, it can be dissolved. So those things you should know what you should do. Never be overconfident. We are not even as a spiritual healer or vibronic healer. We are not paid, or you can say so very well to take a risk or anything, and not to become more smart also. We will already. I told you, you have to handle the what you call non-life threatening diseases. But we should know in case of this what we have to give. The same thing in when I was there along with my father early morning, 7 o'clock, he got an attack of paralysis. And my neighbor was a nephrologist also. He was going for a walk. Suddenly he happened to see, and I was in the next room. And so he was uttering the mantrams in the morning, so he could not say the mantra. Suddenly he's one side of his body started losing his ability to even walk and move. Suddenly, then what I did that time, I was having the blood thin. I mean, the other day I shown blood blood thinners, all made by the snake poisons. I had it was during the Corona period. So that was one of the most frequently required dose. We made it, named it an advanced remedy. I gave it 2 3 times, and I approached. He said, "This immediately approach to the hospital." We reached the hospital within 1 hour. He was all right. Still, we took his brain MRI, and morning 7 o'clock he had a paralytic attack. Afternoon 12 o'clock he was totally all right, and we brought him in home. But after that he is he passed away after 5 years of that incident, but he did not remember that he had a paralytic attack. That is the beauty of this remedies. Okay, so I already told you what I gave you from the Pathak repertory. Go to the thrombosis chapter. Whatever 3 4 remedies are there, Bothros is there, Vipra is there, Naja is there. All snake poison are made a blood thinner in the Vibrionics only. You know that you can keep, and you can use it for like in this emergency, and approach to the hospital. Okay, so like that you will get the confidence for attacking, or you can say tackling all the serious cases also. But you should have some person along with you. Yes, Kumar sir, tell me.
Sir, typically, sir, after around 50 plus years of age, and normally, not for all, at least 70% of them will have calcification in the arteries,
Yes.
right, sir? So for that, without testing, because if we ask them to test, nobody will go and
Correct.
test. So
Correct.
on a general note, can we
Yes.
give this, sir? Like one is blood thinner Naja, and any other thing you would recommend, sir, to reduce the calcification and overall general health?
I recommend you OM7 for all the problem.
Okay, sir.
Organ medicine 7 is the master of everything.
Okay, sir.
If you have a organ OM7, go through that. Coronary arteries is there, coronary everything is there, and even it takes care of everything, blockages also.
Excellent, sir.
Okay, OM7 should be your wonderful remedy. Keep taking OM7. I already told in my many lectures that after 50 years, OM7 is a compulsory. OM7 will never produce any overdosage. OM7 is an organ,
Okay, sir.
heart 7, excellently, without any, if you keep giving it, your heart will be very healthy and very strong. Yes, sir.
Noted, sir. Thank you, sir.
Yes, sir.
Thank you.
Yes. Yeah. You can say that if you are getting the symptom of those things, only you have to give. But whereas organ remedies can be given without getting the symptom also. All other remedy, Naja is a cobra. We will study that, I will teach you the Shankaran system also. Rajan Shankaran system also, when we study those things, we can classify a particular patient into the vegetable kingdom, mineral kingdom, or the animal kingdom. We can classify. Just listen, keep on listening to his talk. By just listening only, we can classify him whether his remedy belongs to इसके अंदर कौन सा भूत है, मिनरल का भूत है कि एनिमल का भूत है, या और प्लांट, एनिमल एंड मिनरल, कौन सा भूत इसके अंदर चढ़ा हुआ है, पता चलेगा. बेस्ड ऑन दैट वी कैन सिम्टम सिमिलरिटी, सिमिलिया सिमिलस कुरेंटर, like you are like. So you have to find out what is there in that. उसके अंदर का कौन सा भूत लगा हुआ है. And all Nagaraj, Naja, we all know that Nagara has got a revenging tendency, revenge taking tendency. If anybody, if you can see him a snake like quality, revenge taking, and some people, they will be doing like this. They will be putting their tongue frequently out like that. So that is the tendency of the snake. If someone is doing like that, you think, try to match with the snake poisons materia medica. See, what are the snake poisons? Crotolate, Naja, Lachesis, Vipera, and Bothrops. These are all snake families that are used in homeopathy. You try to see if anything is similar to it. Okay, very nice. And Kumar sir, as you have asked, one of the best remedy as a heart tonic is the Cratagus.
Okay, sir.
Cratagus, but it should be given in the low potency, or you can say zero potency. Don't drink too much. Like, अपना ही factory है करके एक glass मत पीना. Only you have to take a 10 ml, 5 ml only. Cratagus, Q potency, sudden terrible pain in the left side of the chest radiating over the heart and the left arm, despondent and fearing of death, and 5 drops of the dose, mother tincture in the water with immediately after meals, head remedy for all heart disease. Okay? Head remedy for all the heart disease. Cratagus also can be given along with the OM7. Fantastic. बहुत अच्छा हुआ. You asked a very good question so that it is useful for everyone. See, again, Naja आया. Naja means what? See, I joked once, if a heart problem is there, what to do? Give him all snake poison. So like that, you see, the one is Lachesis is a one snake poison, another is Naja is another snake poison. All the snake poisons are helping the heart in the diluted form, or in can say in the thought form, if their symptoms match. Yes. My idea of taking first 3 remedy of every disease is excellent, because you are going to cure, or you can say going to handle most of the problems. Arteriosclerosis. What is the arteriosclerosis? Just now you were telling, someone was asking me that, thickness of the arteries. Aneurysm we saw. Okay. Like this, the sclerosis means it becomes thick. The in the aneurysm, it will become wide, dilated, but here it becomes thick. And just like when you are putting any watering a plant, that time if you put a finger on the tip of the pipe, then what happens? That water flows fast. It makes the high BP. Its blood pressure more. For such thing, that is the arteriosclerosis creates a more blood pressure. And for that, most indicated remedy is Briatamur. Remember, Dhananjay ji, one more tips for you. If anybody is suffering from the high BP, Briatamur is one of the most wonderful remedy.
Okay, sir. Okay.
Briatamur, calcarea floor, these two. If we give that time what happens? That blood vessel become smooth and person will have a normal BP. And arnica arteriosclerosis, vertigo of the aged, tendency to hemorrhage. Okay, and the second one, plumbum metallicum. Hypertension, arteriosclerosis, very people, chronic nephritis. See, some people, why the kidneys goes to task, or you can say when the kidneys spoil because of sugar and the high BP. So to avoid that, because see, those who are taking the remedy for high BP, they will not have any problem. Some people, they call as the neglected cases of the high BP. So if you don't take medicine, it is fine, but keep checking your all parameters. Okay, so neglected high BP will lead into nephritis. So the high BP reason is arteriosclerosis, and the head of the remedy for Bratamur, arnica, and plumbum metallicum. And one more marvelous remedy is Arum Mure. Excellent remedy for high BP. So you can think the first four remedies, I told unofficially, I will tell you, go to any complaint in this book, use first four remedies and mix and give. I am telling this unofficially, right? Give it and you will find excellent result, and try to match the symptoms. Okay, this is what is a one classical homeopath supposed to do. And I want you all should be the classical homeopath, like homeopath, how they are, they will be able to handle every case. Likewise, you also should do, but our tool is Vibrionics. We can do. I was just talking to one person, I think yesterday, the David Tansley. He wanted to know more about the David Tansley. I said David Tansley in one of the book, Dimension of Radionics, he has mentioned that radionically produced remedy worked far better than the original remedy. So have a faith and do. Pakka, you will get a good result. Okay. Adrenaline, adrenaline, when we come to the endocrine glands, after the urinary system, we will go to the endocrine system. There we will understand due to the adrenaline, there will be a BP variation. So if adrenaline in 30 potency, it bring back the normal. In the same time, if you have a low BP, adrenaline and in the lower potency, if you give, it will increase the BP. So like that in adrenaline 6x, in our case, increase the BP, adrenaline 30, 200, it reduces the blood pressure. And there might be such a content in this book which I may not be knowing. So when you are going into the subject, you can become master more than me. This I book read very long back, last 25 years back. I read this book, and 1987. It's my first books. So in that way, we can think I tremendously used this book. Arsenic iodide is one of the specific for all the heart disease, slow pulse with a palpitation of the heart, breathless, cannot go upstairs, deficiency of mitral valves, mitral constriction with anginious pain, should be given in 3x titration thrice a daily for half an hour before meals along with any other indicated remedy. This remedy should be given along with the other indicated remedy in the all heart diseases. Dekho, I was talking about the other remedy. He is emphasizing, or you can say arsenic iodide is one of the remedy, because why arsenic iodide is one of the tubercular miasm disease. Tubercular miasm disease. So for that reason, he thought that yes, there is something defect, manufacturing defect. Any manufacturing defect is a main basic miasm is tubercular miasm. So he is maybe thinking like arsenic iodide 3x with our machine can be given before half an hour before meals along with any other remedy you want giving, you can give. His knowledge is superior, most superior than any of the suggestion. Even I am telling you, even the our Narayani mixtures also. This is the first top priority, because you have to individually you are seeing the inside symptoms. What are the symptoms? Blood pressure high. Also sclerosis. Okay, and what are the lacasis is the head remedy for blood pressure. Lacasis is again what? Is a snake, deadly snake. And that one, we are in the vibrational form, cannot be in such cases. I request you, do not transmit the snake poisons and all poisons and all. Just you remember immediately for 5 minutes, 2 minutes, you can do it and immediately remove it. Nothing going to happen. You are not going to make him to die. But still, it is character like that. Uska dharma. Now today I was going through the Sri Ravi Shankar's lecture. He was telling that every material has got its own dharma. Like the poison is the dharma of the snake, but we are using it in a opposite way, in a homeopathic form, in a most diluted form. Okay. Next is Aurum metallicum. What is Aurum metallicum? Anybody? Aurum metallicum. Aurum metallicum is a gold. Probably in India we wear gold on our body. Maybe no, in a small quantity it should go into our it should go to our body, and it will prevent from many sort of type of diseases. Maybe a blood pressure, maybe because Aurum metallicum, when it proved in the healthy human being that it is making the heavy depression, it is creating the depression. So for that only, we all men create a lot of tension to the women. So for that reason, they wear the gold ornaments, and God gives them the ability to sustain with us. So Aurum metallicum is one of the wonderful remedy for all sort of the blood pressure problem, and even very good for our blood vessels. Next is, what is the next one? Aconite allium sativum. Allium sativum. What is allium sativum? Allium sativum, Dhananjay, what is allium sativum?
No idea, sir. Sorry.
Allium sativum. We know allium cepa last time. Okay. Allium cepa is an onion.
Onion, okay.
Alum sataivim is the garlic.
Garlic, okay.
You've been told, or even our Ayurvedic people in generally we say that the garlic reduces the cholesterol, or you can say thickening of the blood vessel. Here also they are mentioning allium sativum is used for fleshy patient who eat a great deal of, especially non-vegetarian, has vasodilatory properties. Arterial hypertension or fall in the blood pressure begin usually 30 to 45 minutes after 20 to 40 drops of this tincture. Okay. And what we learn from this? Those who are having low BP, those who are having low BP, they are not supposed to eat the garlic. The garlic will make some more down. So, not to eat, this is only for very high BP people. Those are, and also probably in our non-vegetarian preparation, they use a lot of garlic, maybe to avoid the side effect of uh, you know, the non-vegetarian food. What they are telling, Alim sativim is very good, especially after having non-vegetarian things. So in our Indian preparation, they already mix that into the non-vegetarian and give, so that even after eating the non-vegetarian, you should not have a side effect. I'm joking. Okay, take it as a joke. Okay, so one more thing, common things, because how we, without knowing any theory about the homeopathy, you should be able to prescribe the remedy. See, you heard the anybody is having high BP should not eat the salt. You heard about it?
Yes,
Yes.
sir.
Yes. So here you see that netramur is one of the remedy for the high BP, but in a diluted form. As we thought, when a coffee made us very active. Okay. After taking coffee, we become very active. So then to make us sleep, or you can say to make us to have a relaxation, we give the coffee in the same coffee in very diluted form. Likewise, in here we tell to avoid the nitramure. Nitramure, what is nitramure? Sodium chloride. What is sodium chloride? It's a salt,
Yeah.
common salt. We say don't take the salt, but here we give salt in the high dilution. We give in 200 dilution. 200 dilution, if you give, what happens? One secret I will tell you here, please listen. Anything if you're taking, after taking that, if it is created a poisonous thing on your body, to remove that, give the same thing in the 200 and above potency. That will make you totally relax. So someone is taking tobacco in very means frequently since very long time. If already tobacco poisoning already happened in his body, to give him, what you have to do to get rid of those things, you have to give same tobacco, or you can say tobaccum inflata. You can give more than 200 potency, so that all his that poison things will be drained out. So likewise only here we give the netramure. And what is the next? Carbo animalis. We studied in this one. Carbo animalis with obstinate occipital headache. Okay, occipital area. If someone has got a headache along with the high BP, we can give the carbo animalis. Gelsemium, due to sudden disappointment of love or a grief, give 200 potency. पूछना पड़ेगा भैया, और बोलेगा तो देना. जलसेमियम इज सडनली डिसअपॉइंटमेंट ऑफ लव. आपको लव का डिसअपॉइंटमेंट हुआ क्या? पूछने से कौन बोलता है आजकल, है ना? बोलता है डॉक्टर्स को, और क्या बोलता है वकील को, सच बोलना. ऐसा करके कुछ ये है, things are like that. So they tell you. So so when a sudden disappointment in love, they are not told either for a men or women. So you can commonly you can give based on what condition it is, and you can give the and you try to just overlook. Bird look at the remedies and try to match the remedies. Okay. Now next is the low BP. Low BP is generally it is indicated for irritable person possessing uric acid diathesis. Your uric acid diathesis means in the big toe there will be a red and inflammation will be there, and the brownish patches on the skin, craving for a sweet, rumbling flatulence, worst between 4 to 8 p.m. Yeah, lycopodium is a specialty. Lycopodium, what is the lycopodium? Very interesting. You should know the source of the remedy. Lycopodium is the first, it is assumed to be the first creature or first thing which came to this universe. Lycopodium is the Pachi. Pache, what is called in this one in English?
Algae. It's called algae, sir.
Algae.
Yeah.
Algae, and another common name for that is moss.
Uh,
MOSS,
yes,
moss.
yes.
Okay. It is the smallest thing which आपका जो हमारा पुराना जमाने में होता था, आजकल तो पक्का घर में घिस घिस के बाथरूम क्लीन करते हैं. Earlier days when we were kids, that time not such a high glazed tiles were not available. That time we used to lie the stones, and on the stone पानी जब डालेगा तो we get a greenish moss creation on that. It is called as that is a lycopodium. And when that was given as a poisoning, to know what is the efficacy of that lycopodium to what all the lycopodium can cure, it is given to the healthy subject. When healthy subject responded with the so many different symptoms, that symptom were recorded and made the materia medica. So here, common symptom for, all of you listen very carefully. Any remedies, any problem which is increased between 4 to 8, 4 p.m. to 8 p.m., any problem, gastric problem, any stomach, digestion problem, any problem, you can easily first think about the lycopodium. Okay. And chinin, that is next is nectramure. As we thought, nectramure in the higher potency, it reduces the BP. The same, if we give in a lower potency, it is a common, we all, our housewives have become the very good doctor. So if immediately anything goes, low BP, they give you salt and little bit of, if no blood, diabetes, they give sugar also and mix and give in ORS. That is the awareness given by our government. We get a lot of advertisement regarding that. So like that, netramure given for a 30 potency is given for the low BP also. China is the low BP after loss of vital fluids. What is the loss of vital fluids? We can say urine, or can say stool, like frequent stools and urination, or you can say bleeding. After that, someone loses his BP, blood pressure is going low. That time we can use the China. Okay, as we thought of reading 3-4 remedies. Okay, let us see the CPR. Yellowish tint of the dark circle around the eyes, pulsation throughout the body, desire for the sore, and relief from the violent exercise, empty all gone sensation in the epigastrium, and after lunch, and liver spot, differences in life and loved ones. Yes. And it is a common thing, a thin lady and who has a Alois patch here, Alois, we can call it as a saddle around the nose, like a saddle around the nose, and who is having the tendency to fight with the husband for any cause, or they will find out some cost and fight with the husband. In such, don't ask in front of husband, she will tell lies. So you try to find out, send her, that lady out, and ask her husband, do you fight, or what are the things and what are the likes and dislikes? And they will like pickles too much, and they will fight for a simple reason. And the indifferent to loved ones, they know they are very, they can't stay without them, they know, but still they fight. If such cases with the yellow saddle, it is a pakka sure cases of the CPR. Don't see anything other remedy. Just see saddle like a white patches around here, and the desire for the pickles, and and indifferent to the loved ones, give that fantastic. It will solve many other problems, especially white discharge also. If a ladies have a white discharge, along with this one, pakka 100% is going to cure. Okay. Now, tuberculin to be thought of an intercurrent remedy in the person who is wasting in health. I told you. I told you, as per the Vishwambar Das, he thinks that any wastage of the disease, wasting disease is the tubercular in nature. Any wastage of muscles is a tubercular in nature. So he is thinking it is a tuberculinum is a intercurrent remedy. And calcarea phos, we studied in the calcarea phos in the low BP. When you are talking about low BP, this is a low nutrition. It is as good as low nutrition. And as many as people we are finding with a high BP, the similar or more cases we are coming across the low BP also. For low BP means low nutrition or low absorption power. So like that, because I have already circulated in the group, Vishwambar Das is fantastic book. So please go through this book in case, while I already told you we'll be taking a 3 or 4 remedies. In case you can go into the depth of that. Coronary thrombosis, weakness of heart as if dying. Weakness and trembling of the heart and agitation as if frightened, aching in the pain, apex of the heart, extending to upward, cardiac operation and palpitation with the fear. This is an intercurrent remedy. Coronary thrombosis, if already, people are there, they are, कैसा cases आपके पास आएगा? If the operatable cases, they go and undergo the, somehow उनको छोड़ेगा नहीं वो उनको ऑपरेट करके ही छोड़ेंगे. Okay, but there are some cases they don't, we can't help because of our age, or you can say, they think, this person we may not be able to revive. In such cases, they deny for the operation. Such cases, you can think about this mercurius, and you go through the again mercury, coronary thrombosis. After reading the mercury, what is the next procedure I told you? Go to this book, Pocket Materia Medica, and go there and find out where is Merck Soul, MNOP, like go to the Merck Soul and read there properly. Tally and try to match more symptom from the same remedy, or go to the next remedy. If you think it is not covering fully, there are many things which will be written. How to read the Materia Medica also, it is a knack. Don't see what is not there. In the Materia Medica, 10 different things will be written. If out of 10, if 3 are available in this one, you can go ahead with that and it will cure you. You will give you the good result. Okay? We got that now. Mercurius, corrosive mercurius, we will see mercurius solubilis also. Yeah. Sulfuricus. For example, we'll think about this only. Mercurial throat swollen and stomach incessant green, bilious vomiting, epigastrium, abdomen bruised. It should also match along with that. It should match along with that, and then only you will be able to. Okay. Try to match most of the symptoms. When you match most of the symptom along with those the prominent symptom, you should match the other symptoms also. Then you can give this particular remedy. Where is the selective remedy? Like that. Mercurius, like medorinum. Medorinum is the one difficulty of breathing because of oppression of chest, fluttering about your heart, throbbing pain, quite acute, quick, dull pain, sharp pain, worst moment, burning in the heart, extending to the back and the left arm. It will be there, but one beauty of this will be, which is not written here, is when they are lying on the abdomen, they feel better. Lying on abdomen, feeling better. So likewise, you have to search for other symptom from the materia medica, like this pocket materia medica, and match more symptom like a lycopodium again. Lycopodium, palpitation in the bed, anxious night, turning around the bed, worse after the eating, during digestion, heart action, muffled and indistinct, albuminuria, cramp, constriction of heart, cannot get breathe, stitches beneath the short ribs, like that. Such cases, this is almost acute emergency cases. But if someone has confidence in you, or within your own family, you can try to handle. Or if they left no, they were with no hopes, or I can say whatever is done by them is done, then you can definitely try that too because these are all very serious cases. But it is not, it can't be, have any side effect with our, because it's all totally spiritual in nature. But the guardians, or you can say accompanied people, should have a faith in you. Then only you should do. I told you that, endocarditis, pericarditis, these are the itis means inflammation of the lining membrane of the heart. It's a common problem. And the spigelia is shooting, one single point shooting pain is a spigelia symptom. You can give spigelia for sharp one finger if you want to point out with that no, stabbing pain. They call it stabbing pain. Is a if you come across a word stabbing, ekdam ಚುಚ್ಚಿದಂಗ ಆಗತ್ತೆ. ದೇ ಆರ್ ಪೂರ್ತಿ ಒಂದು ಸೂಜಿ ತಗೊಂಡು ಚುಚ್ಚಿದಂಗ ಆಗತ್ತೆ, ಅಥವಾ ಒಂದು ಸ್ಕ್ರೂ ಡ್ರೈವರ್ ತಗೊಂಡು ಚುಚ್ಚಿದಂಗ ಆಗತ್ತೆ. Like if they're taking screwdriver and piercing into my heart, or like they will tell you. In such cases, spigelia is a wonderful remedy. Again, lacasis and one of the most wonderful remedy is calmia lat. Calmia is one of the, there are remedies which works on specific for some organ. In that category, calmia comes. Calmia basically works on heart and rheumatic heart. And gunpowder. Gunpowder is one of the, wherever itis is there, you can use the gunpowder. Where they have used the gunpowder in our numerical material, the volume 3, in which one they have used? They have used in War 1M. In War 1M combination, they have used the gunpowder. For that reason only, anywhere inflammation, infection, used VAR1M along with that. If kidney is there, KBS and VAR1M. If the tooth pain is there, you use the mouth and gums along with the VAR1M. And if you think that knees are red and painful, use the knees 30. Along with that, you use the VAR1M. If you want more powerful than the VAR, then what is the remedy? Penmycin. Penmycin is that penicillin and the combination of penicillin and streptomycin. That is our, I think, mixture number. I don't remember. Penmycin, with that, you will be able to cure more severe type of infection. Okay. So likewise, you should know your remedies and वो क्या काम करता है. You should be just like your own kids or your own pets. वो क्या काम करता है. कोई नया मेहमान आएगा तो बोलेगा ना, अरे रे रे वो कुछ नहीं करेगा, कुछ नहीं करेगा. तो एक बार कोई चढ़ गया तो पता चलेगा. बट हम बोलते कुछ नहीं करेगा, because we know the character of those our own team. So likewise, you should study each and every. I tell you, don't go to whole this Mathematica. This is the first, second line. First, you go to our Narayani volume 3 and study each remedy. Like VAR1M. VAR1, infection anywhere in the body. They have written only one word. Infection anywhere in the body means why it is arresting, or you can say addressing the infection. Go to the Materia Medica and study each and every medicine, and you get the confidence. Then you get the confidence, you will be able to handle very easily, more easily. Okay. Then heart disease in general. See, digital is any pulse irregularity. And there I was, asked me what is the symptom of the hole in the heart. It is generally in the children only, because this is manufacturing defect. And I have seen a kid, they used to take a long breath. So very frequently used to take the long breath. That is a main symptom of heart in the hole, or you can say oxygen, insufficiency of oxygen. So that time digitalis is one of the most important remedy. Heavy breathing, worst by lying flabby heart with lassitude, faintness, exhaustion, and extreme prostration, horrible dreams of sinking stomach, fear of going to sleep, and it will cause suffocation. See, these are the symptoms of digitalis. Strophanthus. Strophanthus is also one of the very good remedy for eyes also, like a eyesight improvement. How will come to know? When you study about Strophanthus and go into each section of the remedy, it will show you, it will reduce the myopia. So, general heart remedies are this, but you should know what is the symptom of it. Cholinsonia. Cholinsonia is also a disease of the heart with a spell of fitness and this thing. It will, when you follow the repertory and go by the symptom, you will guide into this particular one or two remedy. Then you have to go into the depth of it. Then you will be able to individualize this remedies. Cactus G. What is cactus G? Cactus plant. Have you anybody eaten the cactus fruits? Red fruits, they are very tasty. When we were children, we used to go the hills around, then we used to get the cactus fruits. We used to eat it. And it has proved that it is creating the angina. Angina, that is a chest pain. Very good. All homeopathic remedies, all homeopathic combination of the heart will contain the cactus G. I told you, don't forget, whenever you are going to the homeopathic shop nearby, just make them friends and buy some therapeutic guides. Just go and say, can I take this? You ask, they will be happy to give you. So they will think that you will be, by reading that, you will come and buy some remedy. But you go to those remedy, you make it with your machine. Make with your Nada Brahma, Param Nada Brahma, and try to see. I'm very happy that few of our team members, they are using Nada Brahma like anything. They shared their experience 2-3 days back. They are very happy with the Paramanatha Brahma. Okay. Next, yes, hypertrophy of the heart. I told you in this book again and again, I'm telling the remedies are arranged in the probability basis. So it is good enough to see 1 or 2 or 3, 4 remedies from the each problem. Okay. So hypertrophy of the heart is enlarged, because that is generally heart. Why it get enlarges? Due to what do you call, to metastasis, create a metastasis. If something is wrong, to compensate that, it heart becomes heart enlargement. Or you can say, keep on, the pressure due to which is coming back, or you can say pushing, if it is increasing due to the strain of the heart, it becomes the enlarged. So best remedy for the heart enlargement or any heart problem is the Crataegus. I already told you, Crataegus is one of the wonderful remedy. Along with the OM7, we can give it on regular basis. Wherever you will not have any heart problem for sure. I am telling you again, I will start taking it from today. I will also start taking it from today. Crataegus Q and OM7. Pakka. You take it, your heart will be pakka 100% safe. Kalmia luta. I think Kalmia latisus. I don't remember the full name of this. We call it by Kalmia. Kalmia is hypertrophy valvular disease. Yes, I was telling you why this hypertrophy, because of valvular disease and the heart following the attack of the rheumatism and rheumatic heart. I already told you, RHD they call rheumatic heart disease. Kalmia is a top remedy. Maybe in next day may be telling it, or the hypertrophy. If the enlargement of the heart is there, then that is a remedy. Arnica, Rustox, Laraceris, and the iberis. Iberis is also very good remedy for, along with the heart. It has got again the cold hands and feet, choking sensation of the throat, conscious of heart action. If you are not supposed to be conscious about the heart action. If you are conscious about the heart action, that time मुझे लगता है कि मेरे को बीटिंग, हर बीटिंग मुझे समझ में आता है, और like that it is a very good remedy. Remedies in general, iberis. It even takes care about your kidney also. So likewise, iberis. How I came to know? I read it. If I given it for some too many different reason. So for that reason I remember it. Okay. So cactus, inflammation of the veins. It is called as phlebitis. Okay. So the veins. Now we have come to the blood vessels. So veins, any hemamalis is basically for all vein problems, vein related problems. All vein, varicose vein, or you can say piles and portal veins, all places you can use the hemamalis. Even it can be used in an external application also. Okay. Pulsatilla, when a childbirth and parts are bluish soreness and this stinging. Okay. Sometime when in the following the childbirth, if you think that some greens, part become a green, So that time also we can use it. Hypogeum. Hypogenium. Hypogenium is when then in the phlebitis the pus is formed. Like in the varicose veins, sometime the varicose in veins you get a pus formation also. During that time it can be used. Palpitation. I told you I was remembering so many snake poison. One snake poison again came here. Palpitation. Aconite, we know it is not snake poison. Naxomica is good due to indigestion, acidity, one getting the palpitation. And next is Vipera. What is Vipera? Vipera,
Brussels viper.
yes, viper snake. Viper snake, beauty of this is wherever it bites, no, that becomes a bluish in color. Bluish in color, that parts keeps, that sad jayega. Decay, that will create a decay of that area. So for that reason, they are using a Vipera here for the palpitation. So it means it works on the heart, I mean to say. All snake poison make and mix in a wonderful remedy. I can give it for a intercurrently, you can give it for once in a week, you can give it for as a heart tonic in the diluted form. Okay, never use in the Q potency. Even though it is a thought form also, don't use in the Q potency. It should be always given more than 200 potency. Okay, now a palpitation is over. You can read for other remedies. There are some conditions here I want to emphasize on. Palpitation brought by listening music, Ambra gricia and Staphylococcus aureus. Palpitation during stools, Antimtat. Palpitation after shock, sulfur and conium. Distalis and opium, palpitation from the grief and after fright. And palpitation from the cohesion, sexual action. And the palpitation and dyspnea. Okay, these are all we already taken. A pulse. Fast pulse, oleander, vomiting and nausea with a fast pulse. Aconite, pulse fast, rapid and bounding. Aconite, I told you, it is just like a storm. I also told my grandfather story. Fear of death. In such cases, pulse, rapid and fear of death. In such cases, definitely you can give that remedy and take him to a doctor. Or pulse bounding phase, full blooded patient, throbbing pulse, carbovage, intermittent pulse with the nose bleed. Carbovage, muriatic acid, when pulse intermittent every intermittents every third beat. Muriatic acid, this is wonderful thing because in allopathy, they say arrhythmia means in irregular rhythm, they just classify and leave it. If you think 1, 2, 3, third again missing, muriatic acid will definitely help. Veratrum pulse drop 30 to 40 beats per again, raise it at once, then falls. Pulse absent with a cold sweat. It is almost, generally this happens in the last stage of death. If someone is irregular and this thing, that time better not to attempt, but still you should know what to do in such condition. Okay, veins, varicose veins, including varicocele. What is varicocele? The veins of the testicle will get swelling and even there may be a swelling of the testicles also. Orchitis, it is also called as a orchitis. We will study when we are studying the male genital organ. Formica, fluoric acid is also one of the very good remedy for veins. Pyrogenum. Pyrogenum is a potentized pus. If that is useful for a varicose ulcer. In our volume 3, what we can give? Var 1M, that's it. Var has got all the thing, pyrogenum and penmycin, both are very, very good. Yes, that is the end of our the circulatory system problems. Now we will see what are there in our remedies and useful combination, like what are there in our Narayani mixtures and our single remedy mixtures. Let us see. No, 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 no. Okay, we will see here only, because it is going, because these were the previous document they were giving in the vibronic.org. Now they are not, they have shifted as something else. They have kept it secret. This was downloaded around 20-30 years back. And the who has compiled this is with us. He is one of the main candidate, our Chetan Sabnis, Dr. Chetan Sabnis from Mumbai. He is with us and he is helping us in many ways. He is using my machine also. So we are very happy with endocrine system. Yeah, we have come to our circulatory system. In circulatory system also, first thing is blood. If blood is there, then only we can circulate, no? So starts with the anemia, lack of blood. So what all we should give? ONM blood, OM blood, anemia, acetic acid is one of the good remedy for anti-tubercular remedy, and hemoglobin. This is a excellent remedy for anemia. You can make the pakka combination of all these this mixture number one, anemia number one, and see what is this, 0009. This is a case number. With this combination, they have cured this particular person. If severe anemia is there, like a 200C Ferromet 200C from the homeopathic store, and iron tablet for 2 months, in generally gave in government hospitals. And what we should observe, we should advise, पालक खाओ, ज्यादा मेथी खाओ, ग्रीन वेजिटेबल्स खाओ, उसमें आ जाएगा करके. So BR1 anemia and calcareous acetic acid, arsenic iodide, is I told you, from homeo store they have written. You don't need to go to homeo store because you have the card of the arsenic iodide and you can make it. And cyananthus, because cyananthus is a spleen remedy, and spleen supposed to be the manufacturing unit of manufacturing of the hemoglobin, red blood cells. Okay, so whenever the liver get inflamed, at the same time the spleen also get inflamed. Liver is in the right side below the rib, and the spleen is in the left side of the just below the rib. Aneurysm, we saw the aneurysm, it was indicated in the single remedy. We saw this is given the aconite, arnica, and cratagus, and iota only get, it becomes the aneurysm. So for that reason, and bratacarb, hydrahelix is from homeopathic store. This hydrahelix also we can prepare, and syphilinum. Arteriosclerosis, again, this is you see heart tonic below. We will go to that heart tonic, and I have made this heart tonic in my This heart tonic only I have made in the mantra 7. I have used this combination only. You can check, because I wanted a short combination, but I wanted to use the Satya Sai suggestion, then I used that. Any bleeding in general, cerebral hemorrhage, blood pressure, you can see veins and piles, and you just go through, you become familiar with these. So NM is, Narayani mixtures. Some people are new in this group. So for them, I'm telling BR18 balance remedies, Soham remedies, like that, all are there. High BP, you can make the combination ready, and just remember that this is all are thought infused remedies. It doesn't contain anything except the thought and the positive intention. And low BP. What are the low BP you have to give? This is already given, and we are also covered through. But here they are adding thyroid gland. They think that adding thyroid gland also will help. Chest pain, cholesterol, circulation poor circulation, and arteries, arteries to to all the problems of the arteries, we can use this. And veins, for vein remedies in our combination, in our volume 3 is all this. Just anywhere you can see blue things are varicose related, it can be a varicose veins or anything like that, you can use. And for a gangrene, we can use this, and we have seen very good result in the starting cases. Hematoma is what? It is also a one of the defect in the circulatory system. The hematoma is, hema means the blood, and toma is, that is a tumor. So any blood tumor due to the excess of blood, or you can say rupture of the arteries, or you can say blood vessel, it makes the blood accumulation, that is called as a hematoma. So for that, arnica, because generally it is due to the injury. After injury, when blood accumulates in the brain or any places, it's called as a hematoma. And hemophilia. Hemophilia is also, see, wonderful disease which can be cured mainly with homeopathy and vibronics, like this, because hemophilia is the, you can say, genital congenital diseases or chromosomal defect, because their blood won't get clotted. Blood clotting time will be more. Blood bleeding will start anywhere. That is a very horrible disease. But we are hemophilia, we can give the blood, same his own blood, if you give the potentized, and it will cure the hemophilia. Heart, do not take patient off from the allopathic drug without doctor's advice. You see here. And I have used the same combination in my mantra combination. When you are going to the last but one page, here in the heart tonic, whatever I used from this combination only. Angina, arrhythmia, we know rhythms, if missing rhythms, or you can say irregular rhythms of the heart. It is that time OM heart and digitalis and and see the heart tonic. This heart tonic you make and keep for yourself, so that anything heart, if someone is telling about heart, immediately you can give along with the other symptom. Excess fluid in the heart. Diuretic. Diuretic means the whenever there is a breathing difficulty, you can assume that there is a heart accumulation of water in the heart. Though Adonis vulgaris, or you can say Adonis ver, and Adonis ver, and the Adonin is there in this. Sorry. So important call. So emergency, emotional strain and blockage. Someone was talking about the hole in the heart. It is already given in the Satyasai combination. Okay. So BR heart 216 311 386 and this one. Okay. Palpitation, pain, palpitation, numbness, edema, platelet count low, pulse low. Okay. You go through. If any water retention, varicose ulcers, you go through, you make a remedies on the same name. So it will live forever. Don't worry. Label it nicely and leave it. Okay. It will not have any expiry date. Okay. Any doubts, please, so that we will clear any doubt is there. We will clear in the next session and we'll continue. I think it has become too late for you all. We have crossed more than 2 hours. Tell me, is there any doubt, sir, please? Kumar sir, Dhananjay sir, Chandan ji.
Sir, no, sir.
No questions.
Today's class was excellent. Thank you so much, sir.
Okay.
Sir, you want to share anything about the other class, sir? That you are not class, sir. Sorry. I
What?
think you posted something, no, sir. The diode ring and something on the.
No, that is what I learned here. And that
Okay.
is, they don't know, just they are telling to use it.
Sir.
Means they were not knowing the technology of it.
Okay, sir. Okay. Because you posted, no, sir, then I did research.
Yeah,
so
correct.
So I thought
Because
maybe you can tell better, sir.